How long does a rhinoplasty take? We're going to answer that today on Beauty Unveiled. I am Dr. Angela Sturm, a double board certified facial plastic surgeon. This depends and it varies widely between surgeons. Some surgeons can do a rhinoplasty in an hour. Some surgeons can take 6+ hours to do a rhinoplasty. It just depends on the surgeon and what they're doing. For me, it depends on what specifically I'm doing in that procedure. If it's just a straight cosmetic rhinoplasty, you just want to change the shape of your nose, your breathing is fine, we're not doing anything with that, it can be in about 2.5 hours. If you do have breathing problems and we want to fix the breathing problems and cosmetic portion of it, that's more your 3 to 3.5 hours to be able to do that. If it's a revision rhinoplasty and you've had surgery before, this is more complicated and it takes longer. So that varies so much. So that encompasses all the way from I had a surgery and I'm super happy with everything except for this nostril is higher than that nostril, which maybe takes me an hour to do, all the way up to we need to redo everything, all of the things from the top to the bottom of the nose, everything. And that can be 5, maybe 6 hours, depends on, what all we're doing. Hopefully it's more in the 4 to 5, but it depends, if you've had multiple surgeries and there's a lot going on. Varies extremely widely. You can also have different kinds of anesthesia. I always use general anesthesia because I feel like my patients are just so much more comfortable. You're completely asleep. I am not worried about any airway issues. Your airway is completely controlled. You have the breathing tube, so everything is completely safe. So that does increase the total time. And so you have time to go to sleep, time to wake up. And so that usually adds on another hour or so to the time where I'm actually working. And then just for planning purposes, you have recovery time. So you'll have the time before the surgery, at least an hour or so to get all of the paperwork done, your IV, meet everyone on the team, get everything ready, go back to the OR, we do the surgery. Like I said, you have the time to go to sleep, the actual time of me doing the surgery, and then waking up. And then we bring you back to the recovery room. And there, you're usually there between 30 minutes to an hour, just depending on how long it takes you to wake up. Everyone is totally different, and it depends on the medications that were given and how they did the anesthesia. If you do general anesthesia, it does take you a little bit longer because there's more medications involved versus doing just an IV sedation or something like that where you're up and you're around a lot faster. Plan on your day taking at least half of the day, but surgery wise may only be 2 to 3 hours. It's okay because that's what you're doing that day and you're going to go home and sleep because you're tired, But as far as the work goes, like I said, 2 to 3 is like the normal, unless you've had multiple surgeries and there's just a lot we're having to do. Sometimes I do pair this with other surgeries because some people will say, oh, well, while we're there, I've always wanted to do my eyes or I've always wanted to do something else. And so you can do other surgeries while you're there. You can do eyelids. You can do a lip lift. The incision, you can share that incision and do a lip lift. You can do fat transfer. People have done lasers, all kinds of different things. You can do a facelift. I limit it to, if we're going to do a facelift and a rhinoplasty, just those 2 things. But if it's a facelift plus other things, I like to separate them out. It's just a long day for you and it's a long day for me. But if you add in those other things, it does make the day longer. However, big picture, if those are things that you were wanting to get done anyway, it saves you on the time going to sleep and waking up, and you're not doing multiple surgeries over time. But just depends on the person, what works for you and what's best for you. But if it's just a plain old rhinoplasty, very simple, just make it look nice, a couple of hours and recovery, you'll be on your way. You come in for a personalized consult. We can tell you the exact time that your surgery would take as well as a quotation. We'll give you a picture of what it would look like, and you can do that at www.drangelasturm.com or follow us on our socials at Dr. Angela Sturm.